Hello students, in this video we'll be discussing about the epileptic treatment. So basically what is epilepsy? Epilepsy is mainly the cerebral dysrhythmia, which means the abnormal impulses which will be discharged throughout the body from the brain, which might lead to loss of consciousness, which we do call it as seizure. And it could or might not be associated, which means plus or minus, which I have represented as, with bodily movements, which we do call it as convulsions, which might also plus or minus, it might or might not be associated with the sensory abnormalities or psychiatric phenomenon. So any of these characters might be a part of epilepsy. Usually epilepsy is categorized into two types, which is focal onset seizures, which means the pathology will be at the particular focus in the brain and it will affect only a unilateral body part or a unilateral side of the body. If the pathology is generalized, then whole of the bodily organs will be involved. Whole of the body will be going through epilepsy. This is called as general onset seizures. So there is a difference. It could be focal, which is affecting unilateral, or it could be general, which will be affecting all over the body. In general onset seizures, we do have various types. First being generalized tonic-clonic seizures, where the patient will be having a tonic phase followed by clonic phase, which will be lasting for a few minutes, seconds to minutes. And the second type is absence seizures, where this will be most commonly found in school-going age group, where the child will be staring at something or blinking movements will be there, but there will be loss of consciousness. Myoclonic seizures, which will be like electric shock-like seizures, which will be found in some type of patients. All of these comes in generalized epilepsy category. Atonic seizures, not every time people will be showing rapid contractions and muscle stiffness. Sometimes there will be loss of muscle tone also. Dravet syndrome, this is something related to infancy, which is always associated with fever. And Lennox-Gastaut syndrome, this was always associated with children, mostly less than 5 years of age, and it is difficult to treat also. So we do have anti-epileptic medications, anti-epileptic drugs to treat. First drug which has the mechanism of action was the following. So how does it act? Usually for the nerve impulse to just get transmitted from the one nerve to one other neuron, the sodium has to go inside. So there is a phase of activated phase, inactivated phase, and resting phase. So in inactivated phase, the sodium can't move inside. We'll just go in detail about this because this same mechanism will be followed by many of the drugs which are coming up front. So here, the inactivated gate will not allow the sodium to go in, so there won't be any impulse here. So this drug, Phenytoin, comes and binds to the inactivated gate and prolongs its duration. It will prolong its duration so that the inactivated phase of the sodium channel will be there for longer time, for longer duration, so that there will be the impulses which are being generated will be controlled. There will be normal impulses which will be coming back, but the abnormal impulses which we are watching till now will be suppressed. These abnormal impulses till now will be suppressed and the impulse discharge will come into pace. Where will we use this Phenytoin? This will be used for mostly generalized tonic-clonic seizures. So the funny thing is, because it is Phenytoin, there will be hypertrophy of gums as a side effect, and hirsutism, which is like a coarse facial features in usually female, hypersensitivity. It also affects the absorption of folic acid, leading to megaloblastic anemia, and it also leads to the malabsorption of calcium, leading to osteomalacia. In newborns, there will be chance of cleft palate, hair lip, and hypoplastic phalanges, which we do call it as fetal hydantoin syndrome. So Phenytoin is contraindicated in pregnant women. Also, if we give this directly into the vein, there is high chances of thrombophlebitis to happen, or if it gets extravasated from the vein, the surrounding area will be necrosed. And also ECG monitoring, heart rate monitoring is also required when Phenytoin is being given. So in order to solve all those problems, we came up with a new drug which is called as phosphenityne, which will also form phenytoin after getting administered into the body. It can be mixed up with glucose solution, which Phenytoin cannot. It is also safer than Phenytoin because it does not cause much tunica intimal damage, so that most of the side effects of Phenytoin will be overcome. Now let us go to Carbamazepine. Carbamazepine also has the same mechanism of action, where the neuronal sodium inactivated channel, the duration will be increased by these drugs, so that the impulses which are generated will be of normal pace. So same mechanism of action. So in order to remember the action of carbamazepine, I have made these images so that Imagine trigeminal neuralgia. Trigeminal nerve, imagine it to be carbamazepine, which is C-shaped. I'm just telling for the better understanding. And the mood disorder. So mood disorder, this is maniac and this could be the depression. This is the normal mood. So remember, C, carbamazepine for trigeminal neuralgia, trigeminal nerve, it goes something like this. And bipolar disorders, and also the renal tubules. It acts like ADH, which means it retains water and salts in the body. So that could be one of the adverse effects of this drug, carbamazepine, water retention and hyponatremia. And there are two drugs which are congeners, oxcarbazepine, eslicarbazepine, which are related to carbamazepine. So we have phenobarbital. This acts, we have discussed it in the other class, that it acts on this phenobarbital, goes and binds to the barbiturate binding site, so that it facilitates the GABA to bind to the GABA binding site, so that the chloride ions will start moving in. Once the chloride ions start moving in, it causes hyperpolarization of the nerve, so that the excessive nerve impulses will be delayed. Primidone is one of the drug. I just made it a simpler way to understand. Watching on the prime, primidone, it just converts into Barbie and PEMA, which means phenobarbital and PEMA. Primidone gets converted into phenobarbital. Primidone gets converted into phenobarbital and PEMA, phenylethylmalenomide. So this is the way to remember. If you want, please take a screenshot of this. You can just remember how the primidone works, how it gets converted. Now we have ethosuximide. Remember ethosuximide, whenever you write, please remember like this, ethosuximide, because it will prevent T-type calcium channel current, which is connecting the thalamocortical region. This will give a typical three heads spike in wave pattern on the EEG when you take mainly for the absence seizures. Absence seizures is characterized by typical 3 heads spike wave pattern, which is characterized by T current which will be flowing through. This ethosuximide will typically block this thalamocortical junction, the pathway which will be alternating with the T currents, so that it will be useful for absence seizures. It will be mainly useful for absence seizures. Ethosuximide for absence seizures. Sodium valproate. Remember 1, 2, 3, 4. I'll just tell this with a mnemonic. Sodium, calcium, GABA, and NMDA. Remember this to be 3 and 4 lettered word. GABA, let's compromise with one thing. So it is having 4 types of mechanism of actions, where it will just prevent the entry of sodium, prevent the entry of calcium, increase the activity of GABA, inhibit the action of NMDA receptors. So 1, 2, 3, 4, get on the dance floor. Just remember, it is a broad spectrum antibiotic. It has 4 different mechanisms of action. It will be useful in all types of diseases. Whatever the epilepsy, all types of diseases of epilepsy, whatever the epilepsy you name, it will be useful in that. So it includes both focal and general both. And the adverse effects will be like, there will be curling of hair, there will be loss of hair, and there will be weight gain, which are the adverse effects of sodium valproate. Divalproex, it is just a combination of sodium valproate and valproic acid, both being in 1:1. So just take a screenshot of this. You can easily remember divalproex. It has almost the same properties like sodium valproate. Clonazepam we have discussed in the anti-anxiety drugs. He is the clone. He is very potent. Anti-epileptic, anti-anxiety drug. And diazepam, here is the diesel engine for diazepam. It acts by both, it acts strong in the initial phase, and it goes into moderate in the later phases. So we do have lorazepam, which is a lorazepam, which can be injected into the muscle also. So this also can be used for treating epilepsies. Clobazam is one of the drugs which also belong to diazepam class. Lamotrigine, usually till now we were discussing about the blockade of sodium channel, the sodium inactivation channel. Now Lamotrigine, because of his excessive laughter, he just blocked everything. He just blocked all the sodium channels, so that there is no influx of sodium channel, sodium ions, so that the nerve impulses will be carrying very in a moderate pace. So gabapentin, gabapentin. Remember it as gabapentin, which means GABA repents calcium entry inside the presynaptic neuron, so that the release of new excitated neurotransmitters, release of glutamate won't happen. GABA prevents or repents the entry of calcium into the presynaptic neuron. And pregabalin also has the same mechanism of action. So we have levetiracetam. It just blocks it. Levetiracetam, from the name we can remember, levetiracetam. Vesicles will be trapped. vesicles will be trapped inside the presynaptic neuron because SV2A protein will be locked. The levetiracetam goes and binds to SV2A protein, and it just makes the vesicle not to release the glutamate, not to release the excitatory neurotransmitter. So levetiracetam will traps the vesicle. Vesicle is trapped inside the presynaptic neuron. Please remember it like that. And we have brivaracetam, which is also a congener of levetiracetam. And we have perampanel. Perampanel, the name itself says ampa-nil. Per. In Hindi we can say per ampa-nil. Ampa to nahi hai, ampa-nil. So we have AMPA and NMDA are excitatory pathways. So we just have to block it. So AMPA will be blocked by per AMPA-nil, so that the excitatory neurotransmission will be blocked. Topiramate, just like the broad spectrum anti-epileptic, just like the anti-epileptic, broad spectrum anti-epileptic, sodium valproate, this also has 3 paths, but except for the NMDA we have AMPA. Both belong to the same class of excitatory neurotransmitters, so don't get confused. It is 1134. Remember GABA to be 3, it just forms a numerical cascade, so that remember Na plus, K plus, GABA and AMPA. Na plus will be inhibited, K plus will be expelled, GABA will be increased, AMPA will be inhibited. So all these which will divert us towards the treatment of epilepsy. Zonisamide, lacosamide will have the same mechanism of action like that of the first phenytoin drug, which is prolongation of neuronal inactivated sodium channel, so that the impulses, the excessive discharges from the brain will be normalized. So remember these terms like zonisamide, lacosamide as the same. This is the same mechanism of action for zonisamide and lacosamide also. Then we have tiagabin. This is a car, I named it as Tiago, cute name. So its function is to bring back the GABA inside the presynaptic neuron. So if we inhibit this transport, remember this T to be transporter, transport back into the presynaptic neuron, the GABA will be more in the synapse, so that the GABA will be acting more on the postsynaptic neuron, so that the neuronal discharges will be suppressed. Then we have Vigabatrin. Remember this V to be the V, this belongs to GABA transaminase enzyme. Vigabatrin, GABA transaminase, it prevents the breakdown of GABA, so that GABA will be rich in the synapse, so that it will act on the postsynaptic neuron, and it will just reduce the seizure activity. Then we have Rufinamide. In order to funny name to remember, Rufi is falling down because of the war, and gas out is nothing but Lennox-Gastaut syndrome. Rufinamide is used in Lennox-Gastaut syndrome. Rufinamide and Lennox-Gastaut syndrome, the current scenario which we are watching. Remember, Rufi is Rupi, it's used for Lennox-Gastaut syndrome. No Rupi and Gastaut. Stiripentol, we do have, it will be useful for Dravet syndrome. It will be Stiripentol will be useful for Dravet syndrome. Dravet is a surname of the scientist who had discovered this phase of epilepsy, especially in infants. So these are the ways to memorize all the things. So this completes the topic of anti-epileptics. Hope you understood. I hope you enjoyed watching the video. Thank you everyone.